I was diagnosed with scoliosis around 12 or 13. There was never much information given to me about scoliosis except that it's a curve in the spine. They made me a back brace to try to help correct it or at least stop it from going any further. After about a year of just really being in pain from the back brace, because they're not the most comfortable things to wear, we kind of just stopped. The doctors determined that my bones had already matured, so there was really no correcting that could take place. If it's not bad enough to have surgery, what do you do for it? And it was kind of, that's when I would say my journey started with trying to figure out how to deal with my scoliosis, because nothing was ever given to me for information. Recently, I started to come here about probably 3-4 months. And yeah, discovered Schroth.
Schroth is three-dimensional curve-specific exercise designed to optimize posture.
A bit of a curve here, a bit of a curve there.
You have to plan ahead, you have to think of tasks you do. You can't just like twist or bend over or pick something up really quick. And you also have to pay a lot of attention to your body, how to learn how to move so you don't make it feel worse, how to sleep a certain way. Now, especially with my daughter, it's so hard. I have to, I can't hold her for as long as maybe other people could with back pain. And in April, I threw my back out for the first time ever. I'm only 33, so that was kind of a big shocker.
Her story was very familiar. She had tried a lot of different treatments. Nothing seemed to help. And she just seemed like a great fit for the technique.
Tall as you can mid-back, tall as you can neck, shoulders.
Having a scoliosis-specific technique has really given us a means for dealing with unique problems related to scoliosis and kind of the unique pain presentation that arises as a result.
I've been in a point of pain so chronically that I almost forget what life is like without it. So I would have to say it's going like not just to where it was, but improving, because I really don't have a good memory of not having back pain, to be honest.
And it really is patient driven. I'm just like the conductor. Jess really did all the work. I just kind of led her in the right direction. It's not uncommon for patients to have some form of immediate relief. I am thrilled with the amount of relief she's had. I'd say it's unusual to be as out of pain as she was as quickly. But generally speaking, you do expect results, within a couple of visits, you do expect symptoms to be improving. So it should be a straight curve of improvement. There's a place for chiropractic, there's a place for massage, and even with, patients with scoliosis. I have many of them, they go to those providers and they get some form of relief. I think Schroth is more active. You're restoring normal posture, you're trying to restore normal function. I think it's the best way of doing that. I also think that those other techniques help as well.
If you haven't tried Schroth, try it, because it really helped with my pain. There's nothing else. I mean, I could do yoga from sun up to sundown and I would still have back pain. It's just the reality of how your bones and your muscles are because you have scoliosis. And Schroth is just, I guess magical is a good word. I don't fully understand how it works, but it works. And the pain goes away. And I've been here for 3 or 4 months, and it was effective after like the second time I was here. And practicing it at home, and it's an effective tool to have, especially when you don't want to be in pain and you don't want to seek other pain management options, I really want to fix the problem instead of just cover it up.